We commonly get patients that call in complaining of sciatica, or they've been diagnosed with sciatica and they want to know what their treatment options are. What's interesting is that a lot of times when these patients come into the office and we evaluate them, they may not even have true sciatica. Now some do, but others actually may have pain patterns that are or referral patterns, I should say, down the leg that are different than sciatica and are actually coming from injured ligaments around the hip or even the low back. Now, true sciatica affects the sciatic nerve, which might cause pain, in that low back or even into the buttock area. Some people might get it where it goes all the way down the back of their leg. But other people might complain of different pain patterns that maybe wrap around the side of the thigh or go straight down their thigh or on the more like inner part of their groin. And so a really good evaluation can help us determine if it's a true sciatica case or if the pain is actually coming more from injured tissue in the low back or the hip. Now, true sciatica, what we often find is that patients that have this condition often suffer from low back injuries or hip injuries, or in some cases both. And I'm going to show you on this model here. This is the human pelvis, and so if I rotate it to the back, this is the tailbone here, this is the sacrum, and then you've got vertebrae bones that go up your spine, and then over here is the hip socket, and your sciatic nerve kind of comes like right through here. So you can see, or I hope you can see, that if, let's say, someone has a hip injury, the sciatic nerve lays right by the hip. Any hip injury could potentially aggravate that nerve. Or from the low back, all of these tissues right here are ligaments. If someone has a ligament injury in their low back where maybe there's some instability there, maybe some extra movement of those bones, it could really irritate that sciatic nerve as it comes down right here as well. Or in some patients, they've got both, kind of double whammy on that nerve. In those cases, doing prolotherapy to those injured structures and recreating stability in the low back, the pelvis, and or the hip can actually get the pressure off the sciatic nerve and resolve that condition.